So hello my viewers, praise Jesus. It's your girl Princess Phyllis M. I'm back again with another video as promised. This time round I'm going to define depression and also explain its symptoms. So when we hear the term depression, what comes to our mind? I'm sure we've had this being mentioned severally during different occasions. So I'm gonna tell you what depression is. So when we talk of depression, we actually talk of major depressive disorder. And this depressive disorder is a common and serious medical illness that negatively affects how you feel, the way you think, and the way you act. I repeat, the term depression, actually, when we talk about depression, we talk of a major depressive disorder. And this depressive disorder is a common and serious medical illness that negatively affects how you feel, the way you think, and the way you act. Depression causes feelings of sadness and loss of interest in activities once enjoyed. If you used to enjoy some activities, you get all of a sudden you're not interested. That's what we mean by losing loss of activities, interest in activities you once enjoyed. So it can lead to a variety of emotional and physical problems and can decrease a person's ability to function both at work and home. Yes, so we're going to discuss about symptoms of depression, how you're supposed to feel to know or to understand that you have depression. So some depression symptoms can vary from mild to severe and can include feeling sad or having depressive moods, loss of interest or pleasure in activities once enjoyed, changes in appetite, that is loss or gain of weight, that is unrelated to dieting. So if you start losing weight and it is unrelated to dieting, know that you have. Okay, if you lose some weight and it is unrelated to dieting, that you're feeding well, you're eating your balanced diet, then know that there is a problem. If you're gaining weight unrelated to dieting, that is you're not eating too much and there is sudden gain of weight, know that there is a problem. You need a checkup. So you get trouble sleeping or sleeping too much. Sometimes you get trouble sleeping at night. You feel it's time to sleep, but you're still awake, and you don't understand why you're still awake because you don't feel sick. So you need to see a doctor. And also sleeping too much. Maybe you've slept well at night and you feel that you still want to sleep even during the day. You sleep consistently with no reason. Know that you might have a problem and you need to check yourself up. So loss of energy or increased fatigue. So sometimes you feel when you're doing some activities, you don't have energy. You just feel like you don't have energy. Know that there's a problem or increased fatigue. You find that even without doing any job, you feel fatigued, tired all the time. Know that there is a problem. So increase in purposelessly physical activities, e.g. hard winging or pacing or slowed movement and speech. And these actions actually are observable by other people. You might not observe it yourself, but other people do observe those actions. So feeling worthless or guilty. Sometimes you feel guilty. Maybe you've done something that is not you didn't want to do. You just feel guilty of nothing. You just feel guilty and worthless. You as if you're not worth. Yeah, so that also might be another sign or symptom of depression. Difficulty thinking, concentrating, or making decision. This is also another symptom that you can think of seeing a doctor. Thought of death or suicide. Many a times you feel like committing suicide all the time. When you such come to your mind consecutively, make sure you see the doctor, because this is not normal. Symptoms must last at least 2 weeks for the diagnosis of depression. So if these symptoms last at least 2 weeks and more, please make sure to see your doctor or a psychiatrist. Remember, we don't see the psychiatrist because we are mad. Yeah, you need to give your history, because he needs a history for it, for you, for him to know how to treat that, and for him to know whether you're suffering from depression. Note this, please. Also, medical conditions like thyroid problems, a brain tumor, or vitamin deficiency can also mimic symptoms of depression. So it is important to go check out what the problem is, because you might think you're having depression, you get the medicine or the drugs over the counter, and you don't really know whether you're suffering from thyroid problem or a brain tumor or vitamin deficiency. So please, when you feel you have those symptoms, please, just the right thing to do is to see a doctor who will advise you and who will examine you to know whether it is depression, whether it is thyroid problem, whether it is brain tumor or vitamin deficiency. So please, I'm warning you, please don't take medicine over the counter. Thank you so much for watching. Wait for another video next time. Same time, same place. Bye bye.